Okay, good morning, everyone. Thank you for joining us this beautiful morning as we take time to talk about breast cancer in our community. So good morning. Thank you for joining. We'll just give it a few minutes to allow more people join us on the webinar, as well as also welcoming people to Navasota Public Library in Grimes County. So we'll just wait for about a minute or two and we will be ready to get started. Thank you. Okay, I think we can go ahead and get started with today's webinar. Good morning, everybody, from wherever you are joining us or listening to us when this is posted on our YouTube channel. Good morning, good afternoon, or good evening, depending on the time that this is being listened to. We want to say thank you for making time to join us today, taking time out of your schedule to, join in this important conversation as we host today's webinar titled, Let's Talk About Breast Cancer. My name is Dr. Veronica Ajewole, and I have the privilege of being the principal investigator and the program director for the Texas Southern University's Breast Cancer Screening and Prevention Center here in Houston, Texas. And it is our pleasure to welcome you all to join us this morning as we engage in this conversation about breast cancer. So our program was funded by CPRIT. CPRIT is a funding agency under the state of Texas, and we have the opportunity to offer convenient, no-cost screening, mammogram, and diagnostic services to ethnic minority women who are uninsured or underinsured that are living in Aries, Grimes, Matagorda, Walker, or Wharton County. We also provide patient navigation and barrier reduction services to enable women and their families to receive these screening services. In addition to this, we provide breast cancer awareness and education, just like we are doing this morning. If you would like to get more information about the services that we provide, we will post this link. The Linktree link will be posted in the chat box. Feel free to click on that link, or if you want to scan the QR code, that will take you to the Linktree where you can get more information about us. You can request services, and we can engage with you a little bit better. Again, I want to say welcome to everybody. Please remain muted throughout the course of today's presentation. We have a lot of good information that has been prepared that will be shared. So if you have questions, feel free to drop those questions in the question and answer box, and we will do our due diligence to ensure that we get to those questions at the end of today's presentation. We want to say a big thank you to Navasota Public Library System. So Navasota Public Library is in Grimes County, and this library provides, full services to the communities in Grimes County. They have computer services, internet services, and capacity to print for members within the community. And they also provide, several other services for the community. And I want to say a big thank you to Ms. Tiffany Byers, the library director in the city of Navasota. I came across Ms. Tiffany in 2020 when we wrote this grant. I connected with her electronically, and she's one of those people that wrote us a letter of support, to show that we are collaborating and that, they will support us in our endeavors. And we are here, we received the funding, and we are so excited to be able to have this collaboration and share this webinar, not just live with other people, all across joining us on the webinar, but we are actually having a physical location there in Navasota Community Center. So thank you, Ms. Tiffany, and thanks to everyone in Navasota that has joined us in person, at that location. And Ms. Tiffany went out of our way this morning to make sure that there is refreshment provided for those that are physically in the building. So again, thank you to you, Ms. Tiffany, to Navasota Library System, and to everyone that is joining us at that location. Okay, again, because we are grant funded, and most importantly, because we want your feedback, right? We want to hear from you how we are doing and what we can do differently to serve the community. So we would also post these survey links in the chat box. Please complete the surveys and share your feedback with us so we know what we can do differently and continue to provide services to the community. Okay, now here we are and ready to, listen to today's presentation that has been put together by our very own Dr. Jazmine Okuboyejo. Dr. Jazmine Okuboyejo is an experienced clinical pharmacist who trained in hematology, oncology, and in internal medicine. She has a strong passion for teaching with over 15 years of experience. She has worked, in Texas Medical Center and has developed strong relationships with physicians and multidisciplinary team at MD Anderson Cancer Center, UC Methodist Hospital, Harris Health System, as well as Baylor St. Luke's Medical Center. Our track record includes providing quality continuing education programs, utilizing our medical writing skills for healthcare professions. Additionally, she has a track record of success, including awards in experiential education from AACP, as well as hematology from AMCP for published abstracts. Currently, she is an experienced director with direct reports, and she has built and created effective means that are proficient in getting the task completed. So without further ado, I want you all to join me in welcoming Dr. Jazmine Okuboyejo as she leads us in this conversation as we talk about breast cancer. Thank you, Dr. Okuboyejo, for joining us this morning, and I will turn this over to you.
Thank you so much. It's a pleasure to be here. Before we get started, I'm going to go ahead and share my screen. Okay, so you all should be able to see my screen. And thank you so much, Dr. Ajawale. As she mentioned, I am an assistant professor here. I'm also at Texas Southern University, where the Breast Cancer Prevention and Screening Center is. I am a clinical pharmacy specialist as well. And so it is my pleasure to be here with you all and share with you all a little bit of information in regards to breast cancer screening, prevention, as well as awareness. So today in this presentation, you should be able to, at the end of this presentation, discuss the occurrence of breast cancer as well as any signs and symptoms of breast cancer. Additionally, you should be able to understand and explain what the risk factors for breast cancer are, as well as when you should have screening performed. So first, let's get into breast cancer, a little bit about what it is and what it means. So National Cancer Institute describes cancer as a disease where the body cells grow uncontrollably, and then they have the opportunity to spread to other cells or parts of the body. So when breast cancer starts, and when cancer starts in one location, it can be considered localized, and when it's spread, then it's considered to be malignant if it's spread outside of that area. So breast cancer, it typically starts in the cells of the breast, and you can see in the diagram of the breast. It can start in different locations in the breast, and even though breast cancer is commonly thought to be a disease of primarily women, men can also develop breast cancer. So that is something to be aware of, but it is something that is predominantly affecting women. A little bit about the epidemiology and statistics about breast cancer. According to the American Cancer Society, breast cancer is estimated to have almost 300,000 new cases this year alone. And you can see here, when you look at a breakdown of females versus males, that primarily it is women who are affected, but there are some men that are affected. As you can see, about 2,700 male new cases are expected in comparison to about 290,000 cases that are expected for women. There is a death associated with it. As you can see, there are deaths expected to be in men as well as in women. So that is something to be aware of. So let's get into a little bit about the symptoms of breast cancer. So I have here a depiction of some of the symptoms that you all may be a little bit more familiar with, and that is the lump, right? Everyone may have heard of, if you have a lump, definitely go get it checked out, and that is for sure. But your lump, it can be in more areas than just the breast tissue. It can also be under the armpit as well. So that is something to be aware of, is that, the lump can be in your breast, but it also could be in your armpit. So if you're doing a breast self-exam, you should check all of that tissue. Excuse me. In addition to that, some additional symptoms of breast cancer are a thickening or swelling in part of the breast, as well as irritation or dimpling of the skin. So if there's like nipple changes, as well as the skin becoming red or flaky, as well as even the nipple being like caved in or pulled in, or even the pain in the nipple area. Some patients have even had symptoms of having bloody discharge or clear discharge from the nipple. So if there's any other discharge from the nipple other than breast milk, that is something that should be definitely followed up on. In addition to that, any change in the size or either the shape, maybe it's disformed or regular shape, that's something to definitely be something to get your physician to follow up on, as well as any pain. So we're going to talk a little bit about some of the risk factors for breast cancer. So in breast cancer, there are risk factors that you can change, which are modifiable risk factors. And then there's risk factors that you cannot change, which are also considered to be non-modifiable risk factors. So we're going to get into a little bit about what those risk factors are, what do those mean if you are in that category, as well as what you could do to prevent the disease if you are in the situation of being at risk. So age is something that we all do. It's a part of the living process. And so most breast cancers are diagnosed after the age of 50. So if you are, getting older, that puts you at risk on its own. And there is nothing really modifiable you can do about aging, but it is something to be aware of. So you're ensuring that you're going to get the appropriate screening. Another thing is genetic mutations. So there's a lot of genetic mutations that are associated with breast cancer. Some of those genetic mutations are referred to as BRCA mutations. So BRCA is BRCA, and they have two types of mutations, BRCA1 and BRCA2. And those are some genes that are associated with a higher risk of breast cancer. And those can increase the risk of breast cancer in addition to ovarian cancer. So if that is something that is in your family history, you would definitely need to be aware of that so you can do additional prevention measures as well as additional screening. In terms of reproductive history, so if you have started menses prior to the age of 12, or either you had menopause after the age of 55, those are some things that can also put you at a higher risk of developing breast cancer, because that means you had more time to be exposed to higher levels of hormones in comparison to those patients who had a shorter menses. So that's something to be aware of when you're thinking about prevention and screening. So breast tissue density is actually something that is measured in mammograms, because mammograms, they show how dense your tissue is in your breast, and they identify calcifications and abnormalities in your breast tissue. So if the breast tissue is a little bit more dense, sometimes it can make it more difficult for things to be identified, or abnormalities to be identified. So having more dense breast tissue is a risk factor. So if you have had a personal history of breast cancer or either any non-cancerous breast diseases, for example, carcinoma in situ or either hyperplasia, those are some of the other diseases that can put you at a higher risk of developing breast cancer. Now, when we talk about familial history of breast cancer, what they're referring to here is specifically like a first-degree relative. So a first-degree relative would be a mother, sister, or daughter, or either that's what they're really referring to when they're talking about family history. And then when you've had previous treatment or using with previous radiation, that is also another risk factor. In terms of diethylstrobol, that actually is a medication that was used in the 40s and as well as in the 70s to prevent miscarriage. So women who did take those drugs during that time actually may have a higher risk of developing breast cancer. Okay, now what about risk factors that you can change or those modifiable risk factors? So, so one of them is physical activity. So physical activity is associated, not being physically active is associated with increasing your risk factors for breast cancer. So what you should do in order to prevent that is to make sure that you have an exercise regimen, as well as you want to make sure that you maintain a healthy weight. When they're talking about hormones, you know, this is like birth control pills, in addition to like hormone replacement therapy. I actually, you know, strongly would recommend, you know, if you don't need to take hormone replacement therapy, to try to steer away from that because it is highly associated with breast cancer. Another thing is the reproductive history. And this means your first pregnancy after the age of 30. Also, if you've never had any children, these are some things that can increase the risk for breast cancer. In addition to that, there are studies that have shown that women's risk for breast cancer can increase with the more alcohol that she drinks. So limiting your alcohol intake would be something that you should do to help prevent cancer. So we're going to get into a little bit more into some of the risk factors we discussed, as well as some of the prevention strategies. So if you look here on the diagram, I'm going to go ahead and use my pointer. And if you look at the diagram, these are some of the sentences we talked. So we talked about the uncontrollable risk factors, so those non-modifiable risk factors. And some of them are gender. It is more associated with females over males. Also, really in age is associated with age. So women over the 50 are diagnosed more. So this is nothing really modifiable. We can do that. When you talk about genetics, we talked really about BRCA, what that means. That increases the risk for breast cancer, as well as menses, starting it early or either stopping menses late. Family history, this means, you know, discussing with your first degree relatives, mother, sister, or daughter, if they've had a history of breast cancer, that increases your risk, as well as any exposure to radiation in the chest area. In terms of those non-modifiable risk factors, those modifiable or controllable risk factors, that is having children or not having children. So not having children increases your risk, as well as giving birth at an older age. Not breastfeeding as well. So if you do have children and you can breastfeed, breastfeeding is something that you could do. It's also a risk factor to use hormone replacement therapy, as well as birth control pills, and then things that affect your weight, like exercise, obesity, as well as eating a lot of fatty and processed foods. So when you get down here to prevention, it's maintaining a healthy lifestyle, exercising, maintaining a healthy weight, as well as limiting your alcohol intake. Okay, so let's talk a little bit about breast cancer screening and what that means. So breast cancer screening, really what it does is it aims to identify breast cancer early, as well as to identify cancer and eliminate or reduce the risk from dying from breast cancer. So today we're going to talk a little bit about the guidelines for average risk women as well as high risk women, and what does all of this mean. So average risk women is a woman that has had no personal history of breast cancer. There is no familial history or strong familial history of breast cancer, or there's not any genetic mutations known to increase their risk, such as the BRCA genes that we discussed, as well as that patient hasn't had any radiation to their chest prior to the age of 30. So an average risk woman, they should actually have the option to start breast cancer screening with mammograms at the age of 40. So they can do that every year, starting at the age of 40. But by the time they're 45, they should actually have those mammograms every year. After the age of 55, they can switch to every other year, but they do also have the option to continue yearly mammograms, and this is all according to the American Cancer Society. So what does high risk mean when we're talking about screening and prevention? So again, you see those BRCA genes that we discussed, BRCA1 and BRCA2, the genetic mutations, also chest radiation at an early age, as well as the first degree relatives, so meaning your mother, brother, sister, or daughter, as well as some of these other genetic syndromes that can increase the risk of patients having breast cancer. So when you look for the screening guideline for patients that have high risk, in addition to the mammograms, these patients should also have a breast MRI. And you notice they should start earlier. So they should start around the age of 30, and that should be every year. So I know there's a lot of talk about mammograms, and you should get your mammogram. And as Dr. Ajawali mentioned, the Breast Cancer Prevention and Screening Center at Texas Southern University does provide those mammograms. But what actually is a mammogram? So it actually, what it does is it takes a picture inside of your breast tissue, and it uses a combination of x-rays to make that detailed picture. These are performed in an outpatient basis. So you should not have to get admitted to a hospital in order to get a mammogram. And a lot of the places are starting to have more advanced imaging. So there are the 2D mammograms, but then some facilities have more advanced mammography known as 3D mammograms. So as you can see here, some of the normal breast tissue, you can see what it looks like on mammogram. And when there is an abnormality, it is picked up, and you can see like a cancerous area was going to be magnified, as well as calcium or calcification is sometimes picked up on these mammograms. And the actual exam itself, what it does is the woman will put her breast tissue inside of the machine, and it actually will compress, the plates will compress the breast tissue and do the imaging to look into the breast tissue and in order to get a good image. So screening, there are two types of mammograms. There are the screening mammograms, and then there's the diagnostic mammograms. So for a screening mammogram, meaning this is done for a patient that is not having any symptoms, these are just regular preventative, should be done on a regular basis. But then there are also diagnostic mammograms. So if you were having any of the symptoms, or someone had symptoms of breast cancer, some of the symptoms we discussed were the lymph, skin changes, nipple discharge, nipple dimpling. If some of those, then there would be a diagnostic mammogram that would actually take a little bit longer to complete. It would be more of a detailed workup to ensure that they were fully getting a picture of what is going on and causing those symptoms. So in patients that actually have a higher risk, you can see that they were recommended to get a breast MRI. So you can see that the female lays down here, she puts her breast inside of the machine, and then she goes inside of the actual MRI machine, and it does the magnetic resonance imaging in there. So a little bit about prevention. So in order for a patient that is at high risk or has a family history of high risk breast cancer, they should actually get something done called genetic counseling. Genetic counseling is where they will do a genetic workup and identify an additional testing to identify the breast cancer risk. So for patients that are at exceptionally high risk or very high risk of breast cancer, there actually is certain medications that they can take, like tamoxifen, that reduce the amount of estrogen that these women have in their breast tissue, and that will reduce their risk. There's also, for patients that are at very high risk, they can also get a prophylactic surgery, removal of the breast tissue. And these are for more patients with those genetic mutations that have them at a very high risk of breast cancer. So one of the things that you could do is do breast self-exam. So breast self-exam is done, you can either do it lying down or in the shower. But the important thing to do about these breast self-exams is to do them about the same time every month. And so one of the things that you could do is you can look. You want to make sure that your breast with your arms by your side are the same shape. They look the same, as well as you're not noticing any like malformations in your breast tissue. Another thing is by touching. So this is to feel for lumps, as well as any abnormalities. And you see they're starting under the arm. If you remember, some of the lumps can go under your arm, and you want to go up and down. In addition to that, you can go circular to feel around the breast tissue as well as you can start out from the wedges and go inside to check. And you should check both of them, and your arm should be up because you want to make sure that you're able to get under your armpit as well. Also, these can be done lying down. Make sure that your arm is up so you're able to get under the armpit. You want to be able to do the complete exam. You can use the same motions, up and down, circular, as well as the wedge motions to check. And there are actual, a number of patients who found their own lumps, and these are really important because early diagnosis is very instrumental in early detection is instrumental for early survival. So I think doing these breast self-exams is definitely something that you could do to help see anything in addition to going to your doctor for regular checkups. So a little bit about some of the types of breast cancer. There are several different types. There's a carcinoma in situ. You have invasive ductal carcinoma. I'm not really going to get into a lot of this. And then there's also metastatic breast cancer. In the beginning, I mentioned that breast cancer, it does start in the breast cells, but if it does spread outside of those cells, that's when it's known to be metastatic and spreading to other areas. So again, those diagnostic imaging are ultrasound, but mammography is the key one that needs to be done. And then in addition to that, MRI. And if the MRI and the mammography show signs of breast cancer or further investigation, that's when they'll do an excisional biopsy or core needle biopsy to identify the actual diagnosis. So some of the treatments for breast cancer has gotten treatment has gotten very advanced. So if you have been diagnosed with breast cancer or know someone that is diagnosed with breast cancer, there are a lot of options available for them. There is surgery that can be used to remove the breast tissue. Also, there's radiation. Radiation is more of a localized treatment, which targets a specific area. There's also systemic therapy, which is chemotherapy, and then hormone therapy, which targets to reduce the levels of hormones that will affect the breast tissue. And then there's targeted as well as immunotherapy. The immunotherapy will use the patient's own immune system to help them fight off the cancer. And then I know we talked a little bit about some of the different types. No, we didn't talk about any of the different types of targeted drug therapy, but there's even more specific targeted drug therapy that you can use. So breast cancer treatment is very advanced, and there's a lot of options available to patients. So in summary, some of the things that I want you all to take away from this presentation is that some of the things that you can do to reduce your own risk of breast cancer is by exercising and maintaining a healthy weight, living a healthy lifestyle, as well as limiting your alcohol intake. As you may remember during the presentation, we talked about some of the modifiable risk factors, which were obesity, as well as not exercising. So doing some of those things like exercising, maintaining a healthy weight, as well as limiting your intake would be ways to prevent breast cancer and reduce your risk. For women that are at higher risk of breast cancer, for example, those genetic associations, there is always surgeries that can be done to remove the breast. And those are in special cases, women who are very high risk, or either medications like tamoxifen or reboxifene. However, those medications do have side effects as well. But those are some options for patients at higher risk. So every woman that is at an average risk, they have the option to start their mammographies at 40 years old. If the patient is at a very high risk, or high risk, they can start at 30. And then if you had any of the symptoms of breast cancer that we talked about, you can definitely see your doctor as soon as possible. So some of those symptoms, if you remember, were the lump, change in your shape or size of your breast, any nipple changes, nipple discharges, skin changes. So some of those are to be aware of, so you can reach out to your doctor as soon as possible. If you notice any of those on breast self-exams, reach out to your doctor as soon as possible. And remember to do your breast self-exams monthly, and always make sure to lift up your arm to get under your arm tissue as well. And with that, I would just like to thank you all for this presentation today and this opportunity. And I would open it up for any questions.
Awesome. Thank you so much, Dr. Okuboyejo, for sharing, some great insights, regarding breast cancer education, just the basic things that we need to know on a day-to-day basis, right? When it comes to breast cancer, because we all know that knowledge is power. When we are knowledgeable about the disease, we know what to do. We know, the signs to look out for. And that can definitely empower us to know when to reach out to the physician or when to take the necessary steps, to prevent the incidence of breast cancer in the community. So thank you for sharing those great insights. From the online attendees, I do not see any questions in the chat at this moment. So please, if you have any questions, please feel free to share that with us. And I will check in with Tiffany in Navasota Library System to see if there are any questions on their end. Tiffany, do we have any questions from your side?
None on this end.
Okay, thank you. One question that came to my mind, Dr. Okuboyejo, which, I do get that sometime, in the community, is when or how do we decide if a patient needs to go for a screening mammogram versus diagnostic mammogram, right? Like how, because looking at that, you had that table that showed us, okay, one is more comprehensive and everybody wants that comprehensive look. You don't want to just have that, not so comprehensive look. So how then do we make the decision to say, okay, screening is appropriate for patient A versus diagnostic mammogram is appropriate for patient B? What are your thoughts on that?
That's a very good question. I think, as we kind of mentioned, so diagnostic, is more for those patients who are experiencing symptoms. So if a patient is experiencing symptoms like maybe they felt a lump, or if they had a nipple discharge, or if they're having breast pain. So some of those signs and symptoms would mean that something is going on or is likely to be going on. And so a more thorough look should be done into those patients that are having those symptoms that are associated with breast cancer. Now, I will say not everybody has symptoms, and a lot of people don't have symptoms. So that is something to just definitely keep in mind. So just because you're not having symptoms does not mean that you're clear, which is why we still want, people to go get those preventative mammograms.
Absolutely, thank you. And, thank you for that explanation. I'm glad that you did mention about the symptoms, right? Because for most people, one thing that we've seen within the African-American or ethnic minority community is, if it's not broken, don't fix it, right? If you don't have symptoms, you don't need to, why question when there is no apparent symptom. But you are very right. There are some patients that straight out of the door, they are symptomatic, and those symptoms are truly or genuinely concerning, while there are some women that are absolutely, totally asymptomatic, and some of them will be caught on screening mammogram. So sometimes the lumps can be too little that you cannot feel for it, even if you do a self breast exam. Or, some people, people pay attention to themselves a little bit differently. So the tingling, the pain, the heaviness, or what have you, that might feel strange to some people might be different for some other people. So because of the subjective nature of symptoms report, right? Every patient reports symptoms a little bit different. So at the end of the day, we just want to continue to advocate that at the minimum, once a patient reaches the age of 40 and their average risk, then we should all advocate and, increase awareness on receiving annual screening mammogram. So it's not something that we do once in 5 years, once in 3 years, or, once whenever. It's something that it should be done once every year. And that's one of the great things that the program that we have, is able to offer that support for women that are uninsured, underinsured, that otherwise would not have been able to, self-cover the cost of this screening mammogram. So I just want to, close that out on that end. But I don't see any additional questions, from our online attendees. So I want to say a big thank you, Dr. Okuboyejo, for joining us this morning. And thank you so much for sharing the great content that you have shared. Let me go ahead and share my screen and, get us through a couple of announcements on our end here. Okay, again, we do have our survey that I've already posted in the chat box. So please feel free to complete the survey for those that have joined us today online, and for those that are in Navasota library location, you can either complete it electronically, or we also have the printed forms available for circulation at that location. Also, we have opportunities for people to request the services that we offer. That can be requested electronically via the link tree that is also posted on the chat box. And you can also send us an email. Our email address is breastcenter@tsu.edu. If you would like to request services, if you would like to, connect with us a little bit more, we are willing and happy to continue to connect and collaborate with people all across the communities that we serve. I also want to announce that we all know that October is the big month where we, you know, go all out. We paint the streets pink for breast cancer awareness. So be on the lookout. We have several events that are coming up. We partnering with, you know, different organizations, co-hosting events, you know, in the upcoming weeks in October, as we collaborate with other entities to increase awareness for breast cancer, you know, all through the month of October. So please be on the lookout for those communication. We also want to make an announcement that we have here in Texas Southern University a grant funded by CMS, so the Center for Medicare and Medicaid Services, funded Texas Southern University about 2 years ago to do a study on aggressive prostate cancer. That study is winding up to a close, and a conference is going to be held in November. Some of us might not be aware that September is actually Prostate Cancer Awareness Month. So, you know, all the past almost 1 hour, we've been talking about, you know, breast and, you know, female and all of that. But we also need to, you know, give consideration to our male partners, our spouse, our support system. So September is Prostate Cancer Awareness Month. So if you have a male, you know, gender in your life, father, uncle, spouse, children, uncles, you know, brothers, share the information with them that, you know, they should also go get themselves checked and, you know, be very aware of what the risks are for prostate cancer and how to, you know, reduce the occurrence of that disease as well. So November 5th, please save the date. Mark your calendars. We will be having this conference titled Face to Face, Shoulder to Shoulder. Let us talk about prostate cancer. Please join us in this important conversation as we collectively address prostate cancer disparity in African American community. You can join us on Zoom or you can also join us on campus here or at TSU. So this is going to be on Saturday, November 5th from 10 a.m. to 1 p.m. I would also post the link in the chat box if anyone is willing to, you know, connect with us regarding this upcoming event in November. Again, this is Texas Southern University Breast Cancer Screening and Prevention Center. We are funded through CPRIT here in the state of Texas, and we offer convenient, no-cost screening and diagnostic mammogram services to ethnic minority women who are uninsured or underinsured, living in Aries, Grimes, Matagorda, Walker, and Wharton counties. We provide patient navigation and barrier reduction services to enable women obtain their screening. We also do breast cancer awareness and education, just as we are doing at this moment. And we collaborate and partner with a lot of entities. And today we have our collaboration at Navasota Public Library. And we want to say thank you to, you know, everyone in Navasota Public Library that has supported us today, and especially to Ms. Tiffany Byers for supporting us and, you know, assisting us in making today's program successful, you know, making all the plans and, you know, helping us to get set up at the in-person location there in Navasota in Grimes County. So we're excited about our partnership and we look forward to more opportunities to serve women in our community in Grimes County and all around the counties that we serve. If you would like to get more information about us or request services, you know, scan the QR code or click on the link in the chat box and we'll be happy to share more information with you. We have a presence on social media, so Instagram, Twitter, as well as YouTube. So our handle is TSU Breast Center. So the recording of today's program will be uploaded to YouTube. So if you'd like to get more information, feel free to you know, reach out to us, connect with us on YouTube, and this webinar will be posted in upcoming weeks on the YouTube platform. Okay, and again, thank you everyone for joining us this morning, or, you know, if you are listening to this again, whatever the time is, wherever you are, thank you for joining us, and thank you, Dr. Okuboyejo, for such a great presentation. Well, everyone stay healthy and have a wonderful rest of the day. Thank you.
Thank you so much.
Thank you.